Today on the Exchange podcast, I'm honoured to be joined by Steve Lindsay from the Department of Biosciences. Steve was part of a team that first demonstrated that insecticide-treated bednets could reduce child mortality from malaria, a breakthrough that helped transform malaria control worldwide. Since then, he has led and contributed to research on house screening, larval source management, indoor residual spraying, insecticide-treated bednets, and other innovative approaches to disease prevention. Over his career, he has conducted fieldwork in countries including the Gambia, Ethiopia, Kenya, Tanzania, Uganda, China, Pakistan, Thailand, and Laos, so many countries, and has published more than 280 peer-reviewed papers. He has also advised the World Health Organization and helped to write major global strategies for vector control and malaria prevention. His latest work focuses on how improvements to housing and the built environment can reduce disease transmission. Most recently, he led a groundbreaking trial in Tanzania that found a novel house design significantly reduced malaria, diarrheal disease, and respiratory infections in children. Alongside his role as Emeritus Professor at Durham University, he is also a former director of the BOVA Network, which focuses on building out vector-borne diseases in sub-Saharan Africa. His work continues to influence global efforts in malaria control. The mission of the Exchange podcast is to have thoughtful exchanges with inspiring individuals so that we can learn and grow through the exchange of ideas. Steve Lindsay, thank you very much for joining me.
Well, thanks for inviting me and interested in what you're going to ask me.
Okay, well, before we begin, I have a slightly less scientific question to ask you. When I was researching you, frequently what popped up was you in a profile photo with your beautiful black Labrador. What's the story with your dog friend?
So dogs and animals are a very important part of my life, and I love getting out into nature. And there's nothing quite like taking a dog for a walk into nature and seeing what's about.
Well, so I want to understand a bit about your roots and where you started, and then I'm going to ask how it flowed into your education, and we'll follow on from there. Where did you grow up in the UK?
So in West London, near Heathrow Airport.
Yes.
A totally indistinguishable part of West London, and that's where I came from. Never really wanted to go back, and was glad to escape and go to university and get excited by science and science that would make a difference to people's lives.
And did you go to school in West London?
I did in Hounslow.
Did you enjoy school?
It's always good, and particularly I liked the sport. That was when I got into sport, and I've always done sport throughout my life, and it's a very important part of me.
Mm-hmm. Yes.
And escaping from science and not working too hard and having a relief.
Yes. And are there any experiences, if you look back to your childhood, that have influenced your life almost, and how you chose your career and your life choices?
Yes, failure. I wanted to be a vet right from the word go, and was so sick that I didn't get the requisite A-level grades, and so I resat them and didn't get them there again. So I went to university through clearing. But years later, when I was a young lecturer in zoology in Glasgow, I actually lectured to veterinary science students. So I couldn't be a vet science student, but I could lecture to them, so that was all right.
Do you think failure is important?
It's inevitable. Some things that you're, but then I looked around for something else that was practical, would involve an understanding of zoology. My interest in insects is because it's like being a medical detective. So with insects, you know who done it. And in order to understand how the diseases are transmitted, you have to put yourself in the head of the insect. So whether it's a tick, a mosquito, tsetse fly, whatever, you have to understand the behaviour and ecology of the creature. And I thought that was interesting.
Why do you think that, you said from the get-go, from the word vet, you wanted to be a veterinarian? Why at that time did you want to be a vet?
Because it was an outdoor job working with animals, and I've always loved working with wild creatures and domestic animals as well. I worked for years in kennels and catteries and stables during my summer and during the weekends, which was great. And so now I've left academia almost, and I've returned to nature and I photograph it now. So nothing makes me happier than lying in a wet field in Scotland in the mud at 5 a.m, waiting for a hare to emerge. That's a very special moment.
I'm going to note that down, and I'll ask you a bit more about the photography later. So you said that you failed in your pursuit of veterinary sciences, and then you went to university through clearing.
Yeah.
Was that even your first choice of, what was the university?
No, University of Bangor.
Okay.
It said it at the time, not for high flyers, you see.
I see.
So, and I was so lacking in confidence, I didn't think I would get through the first year and everyone would be cleverer than I was. So I'm the first person in my family to come from, to go to university in my immediate and my extended family. So I suppose that was part of it, lacking confidence. And anyhow, amazingly, I managed to get through the first year and discovered this course. I went to do forestry of all things.
At Bangor? Okay.
At Bangor, because I thought that was an outside job, you know, wielding an axe over your shoulder and cutting down trees, you know,
Yes.
What's not to like.
So that's arboriculture type work.
Yeah,
Yeah.
and wood science, which is the mechanics of what you do once you cut down the tree and you put it into a factory and it comes out as a house or something. But I went and did applied zoology, which was study of parasites and insects in relation to human and veterinary medicine, with a bit of agriculture thrown in.
This was at Bangor?
At Bangor.
Yes.
And from that moment on, I never looked back, and it was great. And so I then got my degree and went to the London School of Hygiene and Tropical Medicine, which has been my home in more than one way ever since.
Yes.
For years going back, and it's such a wonderful environment there, full of people from all over the world, very clever people. And so I was very privileged to have an honorary chair there.
Yes.
For my research, but endless number of friends throughout the building, and it's great. All concerned with largely tropical medicine, but hygiene in its broader context, and it's the pulse of tropical medicine research in the country.
You said that you were happy to get out of West London and then straight back.
And into Bloomsbury.
Yeah. Was it your choice? You wanted to go to London School of Tropical?
What happens, you leave university, you think, need to get a job now, or need to get a PhD. And I took up a PhD in clinical pharmacology, which was so desperately dull, and I didn't want to do it.
At what university?
This was at the Cardiothoracic Institute in Brompton Hospital.
Okay.
Again, West London. But I used to go off at lunchtime to the library of the Natural History Museum and look at journals, learned journals on parasites and insects and things. So that was, and I thought, no, I've got to get out of this. So I wrote to 100 different people from the yearbook of the Royal Society of Tropical Medicine and Hygiene and said, hi, can I come over and see you? And some of them actually replied, and the last one I wrote to, I got a job. So
the last one of the 100?
Yeah, and that was so fluke.
Wow.
So
yes.
I worked as a technician for a year and then did my PhD. And I looked after, so I worked on a disease, the whole group worked on a disease transmitted by mosquitoes. And they transmit a little worm, you might know it as elephantiasis. People have huge legs, millions of people infected in Africa. And so I used to look after the insectary and get these mosquitoes infected with worms. And I was interested in how the worms go through the mosquitoes and how transmission occurs, what actually happens when they bite. And this is where I met my two amazing wildlife photographer friends.
Yes.
Because we had the idea, one of them built his own microscopes, of seeing what happens when you have an infective mosquito feeding on your skin. And so I took a cage of infective mosquitoes, put them in my bike bag. I should say, you wouldn't be able to do this today. There are things that's ethical, such as ethical committees. But anyhow, back in the day, cage of infective mosquitoes, put them in my bike bag, cycled across West London, down through Trafalgar Square to this spot in this godforsaken housing estate, which was full of urine running down the stairs and a lot worse besides.
Okay.
Knocked on the door, and there's my friend John Walsh. Come on in, and there he's got his microphone, his microscope set up, and we photographed the mosquitoes feeding. Mosquitoes feeding on our fingers.
Mm-hmm.
And of course, lots of swearing when you're looking down the microscope, seeing things on the end of your finger. So the worms break out to the mosquito's mouth parts and they wriggle around on the skin surface. And then there's all this mosquito blood that comes out. It forms a dome shape over the puncture wound. They put the needle through the skin. And then after the mosquito takes out its needle, the worms disappear like rats down a drain pipe into the skin. So that was really exciting. I should add that we had a type of worm which rarely infects people. So
did your friend enjoy that as well?
Yeah, we thought it was great. He was a National Geographic photographer and really skilled and just an insanely brilliant man. In fact, he won an Oscar for special effects for the team that took film and converted it digitally. So John was a physicist specialising in optics, so he did the optical part of that. He used to make his own microscopes, go around shops in London picking up bits and pieces and lenses and then putting them together.
Wow.
And then after a while he got fed up with that particular microscope and he would give it to someone, a young person that was interested in microscopy.
And then he'd make another one.
And he'd make another one.
Wow. That's quite...
Yeah, he was an exceptional man.
Yeah. So, from your work with the worms and the mosquitoes, when was the first time you came across malaria as a research?
So I took a job at the as a medical entomologist, working for the MRC, the Medical Research Council, British government funded organisation in the Gambia.
Yes.
And I suddenly woke up and said, this is great, this is absolutely what I want to do. So a very practical intervention and to work on a project to put insecticide on mosquito nets to see whether it protected people from malaria. And of course I knew nothing really about mosquitoes then, because I was more interested in the worms inside and the parasites of malaria, not worms. And so this was a great learning experience for me.
And how old were you then?
So I must have been about 27, 28 by the time I went. So I lived in 5 hours drive from the coast, very remote part of the Gambia, and there's no communication for months of the year, just the radio to the coast. Incredibly hot, 45 degrees centigrade for months. And there were 3 scientists there, and lots of wonderful Gambian field workers and staff, who were probably the only sane people on the field station.
So was that part of your research?
Yeah, so that was a project to see whether insecticide-treated bednets were protective, and this resulted sort of 5 years later in, at the time, what would have been, if it wasn't the largest study ever carried out on malaria, it's certainly one of the largest. I think we worked in 72 villages or Same
The
thing.
Gambia.
Yeah, because we wanted to know, we had evidence that the insecticide on the nets stopped people getting malaria, making them sick, but we really were interested in whether it stops kids from dying. So back in the day, in the Gambia, 1 in 20 children would die from malaria before their 5th birthday. And what we found, so we had 2 groups of villages, one where we put insecticide on the bed nets at the beginning of the malaria season, said don't wash your nets until the end of the season. Okay, I'll do that. And then the other suite of villages we left with their bed nets and didn't treat them. So one set of villages with treated nets, one set with untreated nets. And very soon became evident that the children weren't dying at the same frequency in those with treated nets. In fact, we reduced mortality by 64% simply by dipping the nets in insecticide at the beginning. And from that trial, it was copied in other parts of Africa by the World Health Organization, which is right, it's not the result of one trial. The one trial is very encouraging, but you want to see whether the intervention works in other parts of Africa, and it wasn't just a fluke. And indeed, those other trials also showed a reduction in mortality. So that was, so then the nets were scaled up and indeed improved on by industry to make a net which leached out insecticide slowly and became very cheap for $2 a net, and billions have been given out to across sub-Saharan Africa since year 2000.
And from there, you just decided this is what you love.
And way before that.
Way before that, okay.
But also, I'm a butterfly, and I didn't want to do bed nets all my life, and so I've always been looking at other interventions that you could use, from repellents to spraying insecticide on walls. But right at the back of it, I've always felt that development was a really important part of malaria.
What type of?
Well, malaria affects the poorest of the poor.
So
Economically. So if people are wealthier, they have better homes, better nutrition, better access to healthcare. They don't die in the same way. And a part of that equation, I was interested in the house because, from my own research, most of the malaria transmission comes indoors at night. So something like 80% of malaria transmission is transmitted at night while you're asleep.
Yes.
Okay.
Yes.
So if you stop the buggers coming indoors, then you could dramatically reduce malaria. So I've been interested in housing projects, screening houses, and finding out how mosquitoes find a house. And it turns out that you and I are sitting here producing huge amounts of carbon dioxide. And that's what the mosquitoes tracking in on us.
Yes.
So they come in from distances of about 30 meters. And when they get closer, they can pick up specific odors which say this is a human, it's not a cow. Because the mosquitoes in Africa that transmit malaria are beautifully tuned feeding on people.
So they initially come to the carbon dioxide.
Yeah. Okay. So so they track up carbon dioxide and to get into the house. So this is an issue of physics. So how do you model carbon dioxide? And physicists do that sort of thing. So this has given us an insight into how a house, if you have people inside a house, how the carbon dioxide leaves the house and mosquitoes get in. So for example, a very simple and crazy experiment we did was we're interested in how high a house was above the ground. So we had 4 houses, one on the ground, one at 1 meter above the ground, one at 2 meters, and then finally the one at 3 meters.
Yes.
And as you go up 3 meters, you have 80% fewer mosquitoes getting into the house.
That's all just physics and engineering.
That's exactly, which is why we were working on this healthy house to design a house where you wouldn't get so much
let's move.
Coming in.
Let's move towards the healthy homes. These star homes.
Okay.
We can move to
Yeah, so the star homes is fundamentally designed to protect people against malaria. And those sort of Mickey Mouse studies, the small scale studies that I've done on mosquito behavior and house entry, inform the design of this beautiful house, which architecturally is very gorgeous, and it's won prizes. It's been exhibited at the Venice Biennale and Bonn. But we were more interested in not just building a house to protect against malaria, but to prevent diarrhea by keeping the house clean and giving people lots of water, ready to access, and reducing pneumonia as well, the respiratory infections.
Yes.
So these three diseases, malaria, diarrheal disease, pneumonia, these are the big three killers of children, but not alone. So a child in Africa dies because not only are they malnourished and they come off the breast, they have malaria, another attack, they hold on to the malaria parasites. At the same time, they're getting diarrhea, bang, 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 and respiratory infections. So it's that combination of assault that we wanted to do something about. And what was profoundly important from that study was not only did we reduce those three diseases, malaria by 44%, but the children were taller that were in those houses than those that lived in traditional homes, which shows that the child is fitter, healthier than those in the other villages.
So the research project, it's for the star homes. You built the homes in March 2021?
We took 2 years to build 110 houses.
Yes.
And I think it was, in over 72 villages.
Yes.
And in each of those villages where we had a star home, for every star home we had 4 houses that were traditional.
As control.
As controls. Yeah. So what we did in the first place is we went into the villages and explained to people what we're going to do. Can you imagine them saying, we're going to build you a house? And I'll believe that when I see it. And we had
they push back again?
We had a lottery, so a bucket with numbers in it, and a small child from the village would come and pick the numbers out. And to see who'd got the star homes. And then took 2 years to build these houses, and another 3 years to run the trial, and another 1.5 years to do that analysis and write the thing up.
When did you come up with the idea to build these 110 homes?
So this is a brainchild of my friend Jakob Knudsen, who's an architect.
From written down.
Okay, and Jakob is head of architecture in Copenhagen University.
Yes.
So he and I have known each other, and Lawrence von Sideline as well, the man with the impossible name. And the three of us have wanted to do this for literally years. But you have to, sometimes in life, it takes the time to get to the right place to do it. But what we're proposing here is so out of the box. So if you do an intervention trial, as with the insecticide-treated bed nets, it's one thing you change, okay? You're looking at the impact of the insecticide on malaria, or you're doing a vaccine test against COVID, or a treatment against, a medicine against one particular disease.
One variable.
One variable, but we've got multiple interventions in this one house because we're going to go for it. So it's completely against the grain in the way that we designed this trial, which probably explains why we had to apply 13 different funding agencies in 2.5 years before we finally got the grant to do the study. By the way, we had the money to build the houses, so we just needed the money to carry out the study. Scientists can be very conservative with a small c about trying new things. So this breaks the mold of the traditional type of design.
And then what? So
Not a clinical trial, but
yeah. So Jacob Knudsen was the architectural brainchild.
yeah, yeah,
Designer.
yeah,
and you
yeah.
were
He's the architect. He designed it,
scientist behind the
and
research.
he and Lawrence piloted the house in northern Tanzania, and they tried a just one-story house, and I should say Star Homes is a two-story house with bedrooms upstairs, and made of different materials, wood, and they were absolutely brilliant because they did experiments with bamboo
From Thailand.
From Thailand,
Yes.
so they got a bamboo house builder, shipped the guy to Tanzania using Tanzanian bamboo to make houses for Tanzania. So why do they do that? Because there's a fundamental difference between rural housing in Southeast Asia compared with Sub-Saharan Africa. So Sub-Saharan Africa, the houses are made of wattle and daub, mud. Now mud has high thermal mass, so it heats up during the day and then radiates heat out at night. It's very, very hot at night, even hotter than this room. Compared with Southeast Asia, the houses are made of bamboo or wood, which has low thermal mass, loses heat quickly. So it's much cooler at night, much better ventilated. So ventilation is thoroughly important in a house design because it will act as a cooling agent.
And when you did your work in Gambia and you tested with the metal on top rather than, I think it was straw, you saw that metal is much better, even if all other variables are the same, because it's cooler.
Yeah.
Yes.
Yeah.
And then that's
substantially
why it helps, because it's less of a thermal mass.
Yeah.
Yeah.
So this fed into our studies about, so there's an awful lot that one has to think about in the design of a house with regard to, so it wasn't just protection against diseases, it was trying to cool the house as well, to make it more likely that people would sleep under a bed net, because the main reason they don't sleep under a bed net is because it's too hot. So ventilation is important. The other thing is carbon use. So our houses have traditionally been made from lots of concrete. Well, concrete is the new oil, and it requires huge amounts of energy to produce it. So you take rock from the limestone from the ground and you smash it up and you use heavy industry. It weighs a ton. You have to move it and transport it. Heavy vehicles, all churning out carbon. So around the world, if cement was a country, it would be the fourth largest emitter behind USA, China, India in the world. It's a major cause of carbon production.
Okay, I didn't know that.
In the world. So so we need to build differently to the way we've traditionally been building. And so modern architects today are meeting in small rooms with white walls thinking, how do we rethink how we build houses? What are we going to make? What are we going to do to reduce carbon?
And then bamboo's the idea.
Or whatever, depending on where you are.
I want to ask about, so you said that in the research you found you've reduced malaria by 44%, diarrheal disease by 30%, and respiratory infections, so pneumonia, for example, by 18%. Were you expecting these reductions to be higher or lower? Did you have any projections?
If I'd thought beforehand, that was probably what I'd expect.
Okay.
It's that area of effect size. Yeah. So malaria, 44% is pretty good. Reducing the incidence of the disease. Diarrheal disease. Diarrhea is everywhere in the environment, and it can be pathogens can be transmitted by flies, dirty hands, dirty clothing, all from multiple different sources. unclean water. And pneumonia is, again, it can be airborne, but it could be by contact as well. So those are the sort of levels that we expected. And incidentally, we all know about having clean water, but clean water interventions, where they've done clinical trials, sometimes it's difficult to show an effect. That's not because clean water is a valuable source of, is important. I mean, we all want to drink clean potable water. It just illustrates that the pathogens are so plentiful in the environment that you need to do multiple interventions to break those multiple pathways at which those fecal pathogens spread.
Okay, yes. And your expertise is more the malaria side. Looking back, do you see any means of reducing the 44% even more? Sorry, increasing the cut?
Yeah, so there would have been some protection by people having bed nets, but the fact of, because in our study all the children slept under a bed net, so it's like an additional 44% protection on top of the bed nets. So because in the controlled and intervention, both the children had bed nets. Yes, so there's not one magic bullet. There's some very effective vaccines being produced at the moment against malaria, but they require sort of 4 inoculations over a year, I think it is. We've got very efficient anti-malarials for the moment, and the insecticide-treated bed nets. But what we wanted to do here was really put the focus on the built environment, housing. And this isn't the health department. So if I go to a conference full of health experts, the first thing they would say is, how much does a house cost? Well, it's actually 70% cheaper than a teacher's house would be in the village. But it's still more than $2 per person a year, which is what the health folk are concerned about.
Sorry, could you say that again?
It's a house would cost more than $2 per person per year, because if you're doing a medical intervention, whether it's a vaccine or insecticide-treated net, a net would cost $2 which would keep people safe, 2 people for 2 years. So it's inordinately more expensive than a general health intervention. But Africa is building for the future. So the African population growth is the highest in the world. And so by 2050, it's like the population of India or China will join sub-Saharan Africa. So 1.2 billion extra people.
So in building, you want to build correctly.
Exactly. Yes. So you have an opportunity to build correctly. So it's not about talking to people in health, it's about talking to people in the built environment. By the way, most countries spend something like 50% of their budget on building stuff. So it's what they do. And so there are multiple ways in which you can shape that. One, by building a new design and saying, what do you think of this? Ours isn't the solution, but architects may think, well, that's a good idea. Or I hadn't thought about architecture and health in that way. And they can take various elements from that house and make it their own. But so it's a way of saying, can we do things differently? Can we do things better? Can we make houses healthy? And that's what the Sustainable Development Goals are about. Yes. Everyone wants clean water, better sanitation, help for the poor, improved health.
At the
and that's what we've done.
At the end of your interview with the Durham University, when you spoke about the research, you said that architects, city planners, public health experts, and government officials need to work together to create healthier housing. Have you seen progress in towards getting them to work together?
So that was what BOVA was about, this group of working together between health and and the built environment. So our work was done in collaboration with the World Health Organization and UN Habitat. And UN Habitat are all about healthier environments, healthier homes. So if you've got that broad approach to begin with, that's helpful. But we need to get into the same room as those people that are building millions of houses. We've got to start again in schools of architecture, where people are designing houses in sub-Saharan Africa, well, everywhere actually, and say, when you build, you need to consider the health impacts. We're not doing it in this country. We're not building houses that are cooler, and yet we've known about climate change for at least 30 years.
You're saying in England?
In England.
Yes, yes.
So it's a reshaping it. But there are places that are doing this, and Singapore is a fine example of this, where they recognise the importance of healthy house. And in the 50s, they demolished slums, moved people into multi-storey tower blocks with lots of green space around. And their control of mosquito-transmitted diseases is not in the health department, but it's in the environment. They're all engineers that are running this, because it's an engineering problem.
So was the BOVA, was that started as a result of your research outcomes?
Yeah, so that was my interest in housing. And that stems back from being a PhD student at the London School of Hygiene. I would cross the road at lunchtime and go to the Building Institute and look at what they were up to.
Oh, what university?
It was a showroom for new ideas and innovation in architecture. But then I'd go and knock on people's doors in University College London, who were building stuff, and ask.
At the Bartlett faculty.
Oh, Bartlett recently, but back in the day, University College London. So my work has always been about breaking down silos. I hate silos. They're such an impediment to.
What is a silo?
A silo is, I'm a biologist. I only work in biology. So I smash that out. I work in architecture, urban design, agriculture, forestry, remote sensing, to break down
the barriers.
the barriers. Our departments here in the university, physics, chemistry.
Yes, it needs to be interdisciplinary.
Yeah, absolutely. I mean, but then you have the Institute of Hazard Risk Research, which is truly interdisciplinary.
And were you involved with them? Is this in Durham?
In Durham.
Okay.
In Durham.
Yes.
So always about breaking down barriers. So I think of myself as sort of an ecologist, because I saw a definition from an ecologist, is there are no barriers to your research interests, and I've always been curious and thinking that if I go outside my own area of expertise, then I need to go and see someone that's an expert in that field, number one. Number two, friendly. And number three, not an arsehole. And and that's been my measure of success over the years. I think actually, building on from breaking down silos. We're being recorded now?
Yeah, we can start.
Yeah, so I think one of my happiest memories was working in the bush. One of the places I would often work in, a place called Wadi Kunda. And Wadi Kunda was a collection of mud huts in the Gambia.
Okay.
But actually on the river Gambia. So a beautiful setting, surrounded by trees, and monkeys visiting it every day. Very wild, very basic, very hot. And we had this project to rethink the door. So we wanted to design a door which could be used in sub-Saharan Africa, which would protect people against malaria, mosquitoes, stop them coming in, and also be cool. So we had this sort of louvered door, which was had little holes in it, which were too small for mosquitoes to get in, but allowed air to get in, and was also provide security for people, and was self-closing. So when people let go of the door would shut, and that was it. So it would keep mosquitoes out. So he wanted to test this this special door, and it was just so much fun because we had the guys from Bill Gates, his own factory, not the foundation, who built the doors, and he built parts of the Hadron Collider. So
who built that?
This engineer from Seattle.
Okay.
And so they sent the doors over, these metal doors. So he came over, this engineer. We had the head of architecture from Copenhagen University who designed some of the door variants. We had my dear friend Musa Jawara, who's Mr. Fitsit in the Gambia. One of my students, Ibrahim Ajata, who was from the National Malaria Control Program. Me, who was basically the labourer, and the cook and the watchman. And it was just, that project couldn't have worked if one of those people had been missing.
Yes.
And it was so much fun. Very hard work, very hot. I can remember 8:30 in the morning screwing door handles onto the doors with sweat pouring down my head. And carrying things around, and it was great. And those that must have been 6 years ago. Those doors are still there in the village, still working.
And how did the engineer from Seattle adjust?
It was a bit of a shock. If I can say that there was some sort of cultural shock, it was our friend from Seattle.
And your colleague from Copenhagen.
Yeah.
I assume he's been in Africa.
He's been in Africa. I met him in the early 1990s, and he was in northern Tanzania, designing houses and hospitals, and but out in the sticks.
Yeah. That must have been beautiful by the river.
Ah, absolutely. Yeah, hippos there. People in dugout canoes going past. Selling us fish. And
your photography.
Well. I had a hiatus in my photography during my career because...
What does hiatus mean?
I mean, a little hiccup.
Okay. Yes.
Because I knew that people didn't like to be photographed.
Yes. Yeah.
So I would photograph smiling children, which sounds very dodgy, doesn't it? And now I'm an old man going around Africa photographing children. But occasionally, that was what I would... photography I would do, and the other sort of photographs were more sort of technical ones. And it's been given me great pleasure to see my photographs being used by the World Health Organization for years. In fact, one of the nicest surprises I had was I photographed this 7-year-old girl with malaria, and WHO used that photograph for years and years and years. And I went to give a talk in Kenya to a school, a small school, and there on the wall was a painting of this girl.
Wow.
Someone had copied it, and that was,
Must have been surreal.
It was really bizarre and absolutely delightful, and I was so happy to see that. And so I gave my talk about malaria to the children.
Yes. Did you mention to them that you took the photo?
Yeah. And funny, the other thing that was strange was it was the mirror image of the photograph I'd given to WHO. So I think someone had a slide.
So they drew it
and projected it onto the wall, and then drew around the image.
Wow.
And then painted it.
Yeah.
So clever.
No, I don't think there's a problem with taking photos. And if it's been used widely, then
so if it's technical, I think it's fine.
When I was researching your photos, constantly the featured photos, Steve Lindsay on the bottom.
So it's interesting to also to look back at and to see things that have changed. I have so many times when, particularly from Africans, they look into the villages and they think that's how it's always been. But that it hasn't been. There are continuous improvements. I mean, one of the papers that we published in Nature showing that even in rural villages, poor rural villages, houses are improving slowly, steadily. You know, metal roofs. That was
Over what time period?
over the last 15 years. So I think we looked at 2000 to 2015. They've improved. So, and in Tanzania, where I've been working, people are putting mosquito screening into the houses on their own, without anyone advocating that. And what's really important in any room to keep it well ventilated, particularly during this hot time, folks, you should take notes now, wake up everyone, is you need 2 large windows on opposite walls. And if in the African context, both of them will be screened so mosquitoes can't get in. And then you have a through flow of air. So that's cross ventilation. It's also what you need the next time we have an outbreak of some respiratory virus that's going to kill us all off.
Yes. Yeah.
You know, COVID. This was just really illustrates the lack of adequate ventilation in modern buildings.
Well, this room would not be functional.
This is a sealed, with air circulated within us. You know.
Yeah. In Namibia, we have wired in the door, and then another mesh frame, and then another door that shuts. So you can change it, open it, stops the mosquitoes, or stop snakes, for example, coming in. So that's used as well in Central Africa. Okay. Let's see where I go.
Wally. Okay, interesting stories. Wally Kunda was also.
Wally Kunda being.
Wally Kunda is this place next to the River Gambia, was full of snakes, always full of snakes. So we'd have spitting cobras. There was a baby spitting cobra in the stationery cupboard, the drawers. We pulled it out, and I had one of my students that was collected some mosquitoes from an experiment in the morning. He was in this round hut, and he's looking down the microscope, identifying mosquitoes, counting them as you do. And he had his earpieces in, listening to some music, and getting some sort of background hiss. And turns around, and there behind him was this spitting cobra rearing up. And so he did what any proud Englishman would do. He got on the chair and screamed for help. And whereas Musa Jawara rushed in, saw the snake, screamed, and got the night watchman who came in and did away with it.
Yes. Oh, he can be lucky.
So it's very lucky.
I know my grandma. She was semi-blinded by a spitting cobra.
Oh, really?
Yeah. They're dangerous. The snakes are petrified by them.
Well, we had one student, bless her, Martha Quinones, who'd come from Latin America, hated snakes, knew there were snakes everywhere, didn't go in any of the buildings, and so she set up her desk under a tree with a microscope on it, perfectly happy, until a snake fell from the tree onto her microscope right in front of her. And she never went back there, so we had to move the lab for her.
And was there any other wildlife? Spiders?
Spiders, the hippos are pretty dangerous, because they crush and
they're very fast.
Aggressive, very fast.
Yeah.
Malaria, but
Malaria.
It was surrounded by irrigated rice, so it was just water everywhere, so perfect breeding sites for mosquitoes.
I saw a drone video where you took it up.
Fluid
across, and it's just these expanses of rice.
Yeah, it just goes for miles.
Incredible. It's a perfect breeding ground for mosquitoes as well.
Yeah.
But there's not much.
But nothing in the way of large mammals. I mean, I saw a couple of brown hyenas. There was a guy who spent a lot of time in Kenya, an ecologist who heard spotted hyenas. Could have been a leopard or two around, because they're so elusive. Yeah, I have one of my friends that I worked with. She'd been in Kenya in the 60s, in Nairobi, and a circus visited town, and they had leopards on show, and some 2 or 3 of them managed to escape into Nairobi. So they got in contact with the wildlife folk there from the game parks, and got their trackers to go around Nairobi and look for these, for trying to locate the leopards, and they came back after 3 days and said, we found 8, which meant they're always there in the city, but not just from nobody sees them.
Yeah,
that's because they hide, they dissolve into the background.
In my time in Namibia, I've only seen a leopard in the flesh once.
Only once?
And it was dusk. We were driving back to the campsite, and as it's walking across the road, it's incredible. And my uncle who's lived there, he's never seen leopards in that proximity. It was amazing.
Such beautiful creatures as well.
Yeah, we were very fortunate to see that. And crocodiles as well.
Yes, now that's interesting, because we have the Nile crocodile, which has the distribution across sub-Saharan Africa.
Okay.
But I would go swimming in the
I would not go swimming.
No, exactly.
Wow.
And then we're doing larval surveys, and I've got photographs of me in water up to here. And this looping back to the talk I gave at the Kenyan school. So my friend said, Steve, show them that photograph of you in water up to here at the school. And so I showed this photograph, and visibly everyone went white. And then someone at the back put their hand up and said, do you have any special medicine against crocodiles? But in that part of Africa, the smaller crocodiles, it's not like East Africa, where you wouldn't go anywhere near the water. I think they're more docile. Plus the big crocodile, the big crocs, have largely gone from West Africa.
You're very brave.
Very stupid, actually. A young man. And one of my students would go long distance swimming around the island until one day he hears this noise behind him, and he looks around and there's a hippo.
Yes.
So he did a Jesus Christ the second impression and walked on water, I think.
No, it's nice. They're not playing games.
No, absolutely.
Dangerous things.
No, in fact, I met this guy who was a surgeon in Kenya, and he said that hippo bites are really common, and it's not just the crushing that you get, but they got dirty mouths.
Yeah.
And if they penetrate the gut there, or the gut cavity, then you have to inject so much antibiotics to stop the infection spreading. It's really nasty. More people die of hippo bites than anything else. Large mammal.
We can move on from hippo bites.
From hippo bites. How did we get there? I don't know.
Well, that was interesting. Many years ago, you were in the United States at the airport, and you saw a couple dogs smelling fruits and vegetables.
Oh, yes.
And then that led to you researching dogs and sniffing malaria. How?
Yeah.
Tell the story, please.
Yeah. So dogs have an exquisite sense of smell and their ability to detect things. I think they can detect a spoonful of sugar in 3 Olympic-sized swimming pools of water. Incredibly adapted. For those who are listening who've got dogs, you're living with an exceptional mammal. You just don't know how brilliant they are, despite the fact that it's slumbering somewhere in your room. They're extraordinary at being able to detect smells. So because you can train dogs to pick up vegetables or money or things, drugs, I thought we knew that there was a smell associated with malaria because we have evidence that mosquitoes particularly feed on people with malaria, and particularly people with the infective parasite infected to a mosquito. So could dogs pick up that scent? And so we carried out work going back to the Gambia and giving school children little nylon stockings to put on, and then overnight, and then find out which of the children had malaria and which of those didn't by finger pricking them,
Mm-hmm.
and then using the socks to train the dogs, and they could pick up and discriminate very well between people with malaria and those that didn't. And the idea would be to use them at ports of entry. So we were thinking of particularly keen on working on the border between South Africa and Mozambique, where you have lots of people coming over from Mozambique, and the dog could just run down the line and sit or indicate if they came up with someone with malaria. Very speedy way of doing things.
The results from the research was that dogs correctly identified around 70% of the infected children and 90% of uninfected children. Those are quite good results.
Yeah, pretty awesome.
Yeah.
And it was from that. So when COVID struck, I thought, well, what are the things we can do here? Because we've already set up this group of researchers, and what was key in the dog story was the medical detection dogs. Who's the director is Claire Guest, and a wonderful woman she is too. She does all sorts of research with dogs to identify cancers of the bladder, Parkinson's, all sorts of diseases, people with diabetes, etc. We thought, can we get our dogs to detect COVID? Yeah. And first of all, we did the same sort of thing, and it's amazing. There's a very clear smell of COVID. And we tested this using modern chemistry to look at the components of some of the samples coming from people with COVID. This incredibly distinct from uninfected people. And then the dogs were trained to pick it up. Yeah. And as I said previously, they were better than the lateral flow test, particularly at lower levels of viremia.
Have dogs been used at ports of entry since?
No, I mean that's what we wanted to do again, using it at ports of entry, but I think we weren't ready to run and develop it then, but for the future.
So it's
or more simply, to develop an electronic nose.
Yes, with MIT.
Which, but we're still a long way from that. The dog is so much better for the moment. But it's interesting in this era of AI, whether that could be improved and become something for the future. So dog today, AI tomorrow, who knows?
Okay, I'm going to ask some closing questions.
Okay.
Yes.
God, and my daughter and
what
baby
time?
is...
If you need to leave now?
Just a few more minutes. Then.
Just a few more minutes. Okay, so looking back on your career, what research and achievements are you most proud of? What are you proud of?
The trial that I did when I was in my late 20s,
yes.
And we showed that you could stop children dying from malaria with something very simple.
And you said that the effect of that was conservative, 4 to 5 million.
4 to 5 million people, children probably being saved.
Yes,
because of these nets. Not my research alone. I was part of a team. You know, there's a big squad of folk that worked on this. But yeah, so that feels great.
Yeah, and I was curious. Has there anything in your research about malaria? Have you learned anything about people, or if that makes sense? What has malaria research taught you about people?
Two things: how amazing people are, and to had the privilege of working with some of the poorest communities in the world has just been such an insight that I wouldn't have got, and I take my hat off to them. An extraordinarily resilient group of people, and in the main, just absolutely delightful people to work with. And the people I have worked with over the years, that's just been phenomenal.
In a previous talk, you've thanked explicitly the people of Willangara.
Willangara, yes, which is where we did the building work.
So, closing question: if there is a message you could leave for students and audience, if they're thinking about their career, I mean myself, I'm just 19. thinking about what's happening for the rest of my life.
Yeah. When students would come and knock on my door and say, "I'd like some career advice," I
Yes.
always gave them a simple message: do what interests you, because you've only got one stab at this.
It's true.
And usually, and it's a wonderful world out there. But do something which you really love to do.
Yeah. Professor Lindsay, Steve,
Yep.
thank you so much for joining me today and for sharing your remarkable story and your work. It's been a privilege to hear about your work and the impact it's had on the millions of people around the world. Thank you so much.
Yeah, thank you. Okay, cool. Martin, very nice to meet you.
Yes.
God, it's hot, isn't it?
Oh, it's terrible. Thank you so much.
So,
Feel free to criticize me, please.
no, I thought it was good.